Welcome back everyone, Professor Andrew Wardley here, thank you for joining me. To those of you watching for the first time or new to me, I'm an international breast cancer medical oncologist with over 30 years of experience and more than 300 peer-reviewed publications. Throughout my career, I've worked not only in cancer research, but also in innovation, leadership and healthcare entrepreneurship. I created the first fully integrated research-driven breast cancer service in the UK, a model built around patient-centred care, equal access and research excellence. From pioneering national and international clinical trials to introducing major treatment advances into everyday NHS services, my passion has always been to ensure that patients benefit directly from cutting-edge science. Across the NHS and research institutions, I've held senior leadership roles that have helped shape cancer policy, develop systemic anti-cancer research strategies, and drive improvements that reduce inequality and improve outcomes. I've also built and led multi-million-pound programs, including the breast cancer research team that I established in 2001, spanning sites from the north to the south of Greater Manchester. I did this at a time when integrated cross-site collaboration was rare, and I did it without formal recognition. As of 2025, I've taken my portfolio in a new direction, into law, with particular focus on clinical and professional negligence. The dire state of the NHS, combined with a consistent failure of leadership to address long-standing systemic issues, which culminated in the abolition of NHS England, led me to refocus on something essential: the empowerment of patients. Patients have for too long become victims of poor decision-making, lack of accountability and substandard care. When we talk about patient rights, one of the most crucial areas to understand is clinical negligence. Clinical negligence occurs when a healthcare profession or institution fails to meet the standard of care that is reasonably expected of a competent practitioner, and that failure results in the harm of the patient. It's not about blame. Medicine always carries risk. But when systems fail, when warning signs are ignored, when care is delayed, when patients are dismissed, or when mistakes are hidden, that's negligence. And negligence without accountability breeds injustice. Every patient in this country has both a constitutional and legal right to safe, effective and respectful healthcare. Under the NHS Constitution and the Human Rights Act 1998 and common law principles, patients are entitled to quality care, to be treated with dignity, to receive honest, accurate information about their treatment, and to be able to seek redress when standards fall short. These are not rights that are privileges, they are protections. They ensure that the trust patients place in our healthcare system is respected, safeguarded and never taken for granted. So how do we define negligence in the law? To bring a successful clinical negligence claim in England and Wales, a claimant must establish three things. Duty of care. Duty of care is that care that the healthcare professional or institution owes to the patient. In healthcare, this is almost always accepted and expected. Doctors, nurses, hospitals have a duty to act in the best interests of their patients. The second element is breach of duty, that the care fell below the standard expected of reasonably competent practitioner in that field. The legal test best known is the Bolam test from Bolam via Friern Hospital Management Committee in 1957, which asks whether the treatment or admission will be supported by a responsible body of medical opinion. The test has been further guided by Bolitho, which clarifies that such opinion must be logically defensible and based on sound reasoning. The third element is causation and harm. Patients or claimant must prove that the breach of duty directly caused the harm suffered, meaning that the outcome would have been different had the correct standard of care been applied. This is often called the but-for test, because but for the negligence, the harm would not have occurred. Only when all three elements are proven, duty, breach, causation and loss, can a negligence claim succeed in the law. So what should you do if you think something has gone wrong? First, speak up. Don't be afraid to voice your concerns. Every NHS trust has a patient advice and liaison service. They're supposed to listen, record and resolve concerns informally at an early stage. More formally, you can write to the Chief Executive Officer. You need to document everything accurately. Keep records of appointments, communications, names, treatment dates, and all correspondence. Evidence is critical to ensure your case is properly examined and that patterns of failure can be identified. Thirdly, seek independent advice. If you believe harm has resulted from substandard care, contact a legal specialist such as a barrister who specialises in clinical negligence law. These legal professionals are not adversaries of the NHS, they are advocates for you. They're an essential part of the accountability and justice system. Finally, demand transparency. The NHS is a public institution funded by you, the public, and it's accountable to you, the public. Openness about mistakes is not weakness. It's the first step to rebuilding public trust and driving improvement. The challenges facing our health system are immense, but they're not insurmountable. They require honesty, courage, and unwavering commitment to accountability and the truth. We owe it to every patient, every clinician, every family to build a system where safety, learning, and compassion are not exceptions, they are the foundation. Together, through awareness and empowerment, we can ensure that when care fails short, patients are not silenced, they are supported, respected and heard. Thank you for watching as I continue to bring you more educational videos and commit myself to support patients and clinical professionals and all that want to improve our systems.